When it comes to using insulin, there are some golden rules. You need the right person, the right insulin, the right dose, and the right device at the right time. When someone living with diabetes arrives on the ward, ask them how they usually manage it. If they use insulin, find out what they use, when and how much. If they don't know, ask your DSN or pharmacist. There are so many different pens and insulins, and they're not all available from the pharmacy at the drop of a hat, especially on weekends, so think ahead. You should never stop, miss or delay insulin in a person with type 1 diabetes, as insulin deficiency can result in diabetic ketoacidosis or DKA. Note that insulin is prescribed and measured in units, written out in full. The prescription list brought by the patient will refer to the insulin concentration. This must not be mistaken for the insulin dose. There are many different types of pens, disposable, refillable, but each pen has been specifically prescribed for each patient. They're not interchangeable, even if they look the same. You must never draw insulin out of a pen device using a syringe for a patient, because insulins can vary in concentration. Doing so could result in a dangerously high dose of insulin being given by mistake. A new needle should be used every time, and always do a 2-unit air shot to check the needle isn't blocked and the pen's working properly. Staff should use insulin safety needles to reduce needle stick injuries. Make sure you know how to use them. Incorrect use can result in missed insulin, a so-called wet injection, and the risk of a hyper. If patients are able to self-administer their insulin, they should use their own needles, but be careful, they may not always remember to remove or dispose of used ones. Put a sharps box by the bed and encourage patients to use it. A subcutaneous insulin pump is attached to the body and delivers fast-acting insulin continuously. If the insulin pump is removed or malfunctions, the person will run out of insulin very quickly, and this can lead to DKA. Contact the diabetes team as soon as possible when a person with a pump is admitted. Most patients are expert at managing their pump. However, when they're unwell, they will need to be assessed to see if they can still manage it themselves. If not, you give insulin either by pen or variable rate intravenous insulin infusion before you take off the pump. Store it safely until they're able to use it again. If insulin can't be given by pump or pen, then only an insulin syringe should be used. Normal syringes should never be used, as it's easy to draw up 10 times the dose. This has resulted in serious harm and is a never event. If you're unsure about the insulin prescription, please check with the medical team. Insulins are made to act at different speeds. This is why the timing of giving insulin to patients is so important, to encourage more stable blood glucose levels and to avoid hypos and hypers. Long-acting and intermediate insulins are ideally given at the same time every day. These are not meal dependent. Rapid, short-acting and mixed insulin should be given before a meal. If you give insulin and a meal is delayed, there's a serious risk of your patient having a hypo. If insulin is given after a meal, it can upset blood glucose levels. Mixed insulin separates out. To work properly, it must be resuspended with a rocking motion of your wrist, and by rolling it from side to side, 10 to 20 times. To ensure accuracy of the result, make sure the patient's hands are clean before you do a blood glucose finger prick test. If there's a high reading on the blood glucose meter, repeat it after washing hands to confirm the reading and inform the nurse in charge. Be particularly vigilant with patients who are very unwell, confused, or have dementia. It's easy to miss a hyper or hypo. Hospital life can be very different from home. Insulin requirements can change considerably. Your role is to help patients self-manage where possible and get ready for a safe and timely discharge. And before they leave, check. Have they got the right insulin? Do they know the right dose? Do they have the right device and enough needles to give their insulin at the right time? Ask if you're not sure.